If you're not already on mute, please go ahead and mute yourself. My name is Billy Najim. I'm the general manager at Lynx Fitness Club. I know I recognize a bunch of the names here on the list, but for anyone that I don't know, welcome to this seminar. I'd like to introduce Zach Kramer, Dr. Zach Kramer. He is the Chief of Emergency Medicine at Morton Hospital, and he's a longtime Lynx member. So Zach, thank you for joining us. Zach has been on the front lines of this battle for quite some time now. He actually was one of the people that brought it to Lynx's attention probably earlier on than a lot of local businesses had been talking about it for, and we'll get into that in a bit. But before we start, I just wanted to start this off by thanking all of the frontline healthcare providers out there. Obviously, Zach, my sister is a nurse at MGH, and she has been very integrally involved in the testing of this virus. So it's near and dear to my heart. But you guys are all heroes. You're risking your lives to save others. So especially at Lynx, we're really appreciative of that. In addition to the healthcare providers, all of the cleaning staff out there in any business, but especially at the hospitals, wanted to throw them a shout out as well, because they don't get the recognition that they deserve. So thank you to all of you folks. If there's anybody on here that's a healthcare provider, thank you. So let's get into it. Here, Dr. Kramer. I know Zach because he's been a longtime member, basically since we opened. And so we thank him for all of his support at Lynx. But Zach, why don't you get in a little bit about your background, talk about your role maybe at the hospital before the crisis, and then give us an idea of how it's changed over the last couple months.
Absolutely. Well, first off, thank you for having me. I really appreciate it. Absolutely love Lynx. Everyone should try to stay positive and try to stay fit and active during these times of quarantine, because it's very important both physically and mentally. So that's the first thing I want to say. So I'm a board certified emergency medicine physician, and I've been practicing for about 6 years plus 4 years of residency. Day-to-day life in the ER has drastically changed over the past 3 months. A general normal day in the ER, we're seeing about 145 people a day coming in with all ailments from the sniffles to heart attacks, strokes, broken bones, etc. I'm kind of the jack of all trades, but master of none. Things have really kind of ramped up though over the past month, as you'd expect. I personally started worrying about this back at the end of December when I heard about Wuhan, China being completely put on shutdown lockdown. And if you think about that, that's a city of 8.5 million people, the largest city that you have never heard of until recently. That's like putting New York on complete lockdown. So right when that happened, everyone's ears kind of perked up in the medical community, because that is a huge feat that only China could probably get done. And since that time, the role in our hospital system has really changed with preparation of the upcoming onslaught of what our fears, pretty much what would happen in China. So now, instead of seeing the regular day-to-day things, people have really kind of stopped going to the ED, which is the appropriate thing to do, unless it's in a real emergency. And we've all been prepared with getting ready for this inevitable onslaught of respiratory patients with COVID-19. So the biggest change now is that PPE. I don't see a patient if I'm not gowned, gloved, masked. It's completely communicable spread right now, which means everyone's got it. You don't need to know someone from Wuhan, China. You don't need to know someone that just got back from Europe. It's out there. It's in the community. It's in the grocery stores. It's everywhere. So right now, everyone is a person of interest.
Gotcha. Thank you for that. And Zach, just talking a little bit, you've been in charge of the emergency response at your hospital, talking a little bit about maybe how your hospital is prepared for the outbreak, and then just in general, if you can give people an idea of maybe whether Boston hospitals may be a little bit more prepared for something like this versus elsewhere in the United States. Maybe just a little bit of insight into, the hospital preparation for this outbreak.
Absolutely. So I can tell you here in Massachusetts, we are literally the center of the medical community for the whole nation. With MGH, BMC, Tufts, Brigham, BI, this is kind of the heart of where medical practice happens in the United States. Back starting at about mid-January, all the hospitals started preparation mode. We kind of, based on epidemiological studies, we're trying to figure out how many people this was going to infect and what we needed to have in order to treat those patients. Not only that, we had to figure out ways how to possibly stem the spread of this disease in our own institutions. If I get sick, I can't help you. So that has been one of the biggest changes. There used to be a bunch of entrances to to hospitals. Now, at every hospital in Massachusetts, there's one entrance. You can only get in through that entrance and you immediately get screened. You generally, depending on your hospital system, you'll get a badge that tells you exactly where you need to go. If you have symptoms, if you don't have symptoms, you can be directed to the emergency department, to radiology, to an outpatient clinic, etc. So that has completely changed. Every patient gets a mask now. And we'll get into mask a little bit later, which I find to be very important, but really to help stem the spread, but also protect yourself. Hospitals have been expanding their ICUs, and that's the most important thing because this is a respiratory virus. It causes, initially it causes a respiratory syndrome called ARDS, acute respiratory distress syndrome, in which your lungs pretty much fill with fluid. Eventually down the road, it causes cardiac issues as well, from arrhythmias to heart failure, leading to eventual death. So every hospital system in all of Massachusetts has been expanding their ICU. That's the most important thing. Getting vents and getting ICU beds. But you got to remember, these beds have to be isolated because you don't want patient in room A to give the disease to patient in room B right next door. So there's been a lot of preparation with just quarantine and control. Pretty much all outpatient clinics have been shut down. All procedural, non-essential procedures, all elective procedures like your screening colonoscopy or your general medical follow-up, your yearly, doctor visit, all that's been canceled. And we are functioning only on an emergent basis now, where we're trying to conserve all of our resources, albeit doctors, PPE, medications, all that is being conserved in expectation of the onslaught of patients that we are going to have. The biggest thing that we're doing now is just, we're in Massachusetts, we're at the beginning of our slope up. I can tell you that over the past 5 days, I've watched our numbers of patients infected with COVID and patients requiring ICU admission do this slowly over the past 5 days. Our numbers that are exponentially growing every single day. And we're kind of just beginning to hit the peak. We're not near the peak. We're at the beginning of that rise, exponential rise up until we hit the peak and then hopefully come down. And that's where we're talking about flattening the curve. So we don't use all of our resources at once. Pretty much everything we're doing right now is in preparation mode. I will say downtown Boston, the big hospitals are already overflowing. MGH just opened up another, or I should say they're trying to open up another 60 ICU beds. Their ICU is already full because we're already getting hit with this. But as I said, we're kind of at the beginning of that slide up, of that climb up.
Yeah, thanks for that, Zach. And it seems like the governor has been, making announcements as well as the mayor with that same message. We're, in the next 10 to 20 days or so, that's where they expect to see the peak here in Boston. So it seems like that's consistent with what you're seeing. I think I'd love to make this as practical as we can for people because, there is a likelihood that one of us, on this call eventually either gets the disease or comes in contact with someone who tests positive. So can you just maybe walk through a step-by-step process? What should someone do if they come in contact or know that they came in contact with someone that tests positive, or if they have symptoms for the disease? Maybe just talk them through exactly where they should go and what they should do.
Absolutely. So first, let's just start off with the disease itself. It's a virus, just like the common cold, just like influenza, the flu. So the way that you get this virus is you have to touch something that has the virus on it, or someone has to inoculate you with the virus. So someone sneezes, coughs on you in your face, and it gets into your mucous membranes, your eyes, your nose, your mouth. Or for instance, you touch a doorknob and someone had sneezed on their hand, touched that doorknob, and went away. That virus, they're finding this specific virus can stay alive on surfaces for a long period of time. Metals for up to 3 hours, plastics for hours, cardboard for 24 hours. So that's the first way. You inoculate yourself, and it's generally, you can't touch it. It doesn't go through your skin. It's you touch it and then you touch your face, your mouth, or you touch a piece of food and eat it, something along those lines. So once you get it, you're gonna get a constellation of flu-like symptoms. You're gonna have fevers, chills, body aches, fatigue. Some people will get some GI symptoms like nausea, vomiting, diarrhea, but that's kind of the exception and not the rule. The hallmark of this specific disease, though, is coughing, a kind of persistent dry cough. And it eventually will lead to shortness of breath. Shortness of breath while seated. I'm talking about shortness of breath walking from here to the bathroom. Very small exertional shortness of breath. And that disease will then progress for some people, and some people will then just get over those symptoms within 7 to 14 days. It's impossible to determine who will go which way. Some people, even 25% is what they're saying now, will be completely asymptomatic. They will catch the virus, they will spread the virus to everyone, but they will have zero symptoms. And that's why the social isolation is so important. So first off, you will develop these symptoms, these fever, fatigue, malaise, cough, shortness of breath. That's normal. Just like the flu, those symptoms you have to treat them symptomatically. There's no cure for it. So rest, drink plenty of fluids, stay hydrated, and then Tylenol. Tylenol is going to be the mainstay of treatment here. It's going to help with the pain, the aches. It's going to make you feel better. It's going to help with the fevers. The WHO and the CDC are still saying that ibuprofen, Motrin, Aleve, all the same family of drugs, is still okay. My recommendation is I would say it's okay to use, but I would tend to lean towards more Tylenol because they are worried about the anti-inflammatory response that this class of medications causes. NSAIDs can actually cause a worsening of the cytokine storm, or the inflammatory process in your body, making it worse. That hasn't been totally proven in literature yet, but my recommendation is to go ahead and just stick with Tylenol. If you need to use ibuprofen, do it. You're gonna have these symptoms. You don't need to go to the hospital for these symptoms. You just gotta bear down and get through it and stay isolated. Things that you should specifically be worried about is worsening shortness of breath. That is a sign that you need to go to the hospital. And what they'll do is they will check your oxygen saturation, where they put that little thing on your finger, and they're looking to make sure that the oxygenation in your blood is normal. I will tell you, you will probably, most people are going to be totally fine. This is the small percentage of people that are going to have these issues. And if you go to the hospital and you feel real bad, they're probably going to do a chest x-ray. And by the hospital, I mean the ER. They are going to check your oxygen saturation. If that's normal, they're not going to do anything else. And that is because we are encouraging people, and the CDC and the WHO have all set guidelines of who needs to be admitted, who needs to be treated, and who needs to be tested. If you just have a small cough and no fevers and you're fine, you probably will not be tested in the emergency department. Your doctor can call and set up an outpatient test for you, where they literally write an order, fax it in, and you can go to one of the outpatient testing sites. There are plenty around the state, in the city, in the surrounding suburbs, where they do the nasal swab to test you for it. And that test takes about 3 to 5 days to come back, depending. We are getting these new 1-hour assays, but those are really only reserved for the inpatient sick patients to find out if they're positive or not. Because again, if they're positive, you have to cohort these patients together. This is really, it's a really function of finding space to put patients that may have it, patients that do have it, and patients that don't have it, and keep them all separate from each other, because you don't want to co-infect each other. So you're going to have these symptoms. The best thing I can do is the best thing you can do is rest, Tylenol, and ride it out. If anything gets way worse, again, shortness of breath being the specific thing that you need to worry about, that would be a reason to go to the emergency department.
Zach, if let's say you do have these symptoms, just to be clear, and thank you for kind of giving us an idea of what might help you and what might not. Is the first step to go to your doctor and call your physician, your primary care physician? Is it, what is the first step to determine what they should actually do?
Yep. So all PCP, all primary care physician visits now are going to be virtual, over the phone or over a Zoom meeting. I definitely think if you develop any symptoms, definitely the right thing to set up an appointment with your physician. You do not need to run to the ER. That's the first thing I can say. People have been doing a fantastic job of avoiding the ER for non-emergent, life-threatening issues, which has been great. Because what you're doing anytime you leave your house, I mean, anytime you go to the mailbox and you come back, you have now possibly put yourself at risk for infection with COVID-19. And that is because it's everywhere. It is communicable. It's the mailman, anyone. And again, you can be asymptomatic and spread. So the moment you leave your house, you are possibly infected. And if you were quarantined, the moment you leave your house, you're no longer quarantined. So you got to start that 14 days all over again. So just to keep that in mind. So call your doctor. Your doctor will decide if they want to do that outpatient testing or not. And they will just keep an eye on you. And they will honestly tell you a lot of the things I just said. Rest, Tylenol, go to the ER if you develop severe shortness of breath. Just like the flu, it's going to suck. You're going to feel real bad for up to a week, and then you will start to feel better and get over it. Again, some people will start to feel bad and then get worse, and that is when you would go to the ER. As I said, your primary care doctor can put in an order for you to get the outpatient testing, but if you turn up positive, I would say if you're feeling crappy right now, assume you're positive because it's out there. Everyone has it. I've been testing people now the past month in Taunton, Massachusetts. That's 45 minutes south of here. We're getting like 60% of the community has it. 45 minutes, 30 miles south of Boston. That means everyone in Boston, it's everywhere. So if you develop symptoms, you probably do have it. And then it's really, you just got to write it out. And again, you can definitely follow up with your doctor, let him know what's going on, but he or she's going to tell you exactly what I just said. It is rest and let it run its course. But if you're feeling worse with shortness of breath, that's a reason to go to the emergency department.
Thanks for that, Zach. Can you just quickly talk about this test? I think it'd be interesting to explain exactly what that means.
Yeah, it's an interesting test. Right now, the standard of care test is a nasal swab. If any of you have ever been to the emergency department or your doctor's office to get a flu swab, it's the exact same process. They take this long, it's kind of like a tiny little brush, and it goes, they put it into the nair and it goes all the way back, and then they twist it and they pull it out. That looks terrible, but most people don't realize that the turbulence of their nose, the way that the actual anatomy of the nasopharynx, it doesn't go up. Most people think it goes up. That's how you pick your nose. No, it goes back. So it's a little uncomfortable, but it's not like, it's not like getting smacked in the face. There are new assays coming out where they can just do a nasal swab with the nairs. There's a throat swab. Those aren't as reliable. And they're also coming out with a blood test, which is, again, the problem with these is they don't really know the sensitivity of these tests. So we do know that the sensitivity of the one that goes in the back of your nose is the best. And I will tell you right now, it is wrong 25 to 30% of the time. So that means if you have it, 1 out of 4 people who have it, it's going to say you don't have it when you really do. That's why I said if you have symptoms, you probably have it. So keep that in mind. But they're coming up with new assays every day, but that's kind of the standard of care of the way we are doing now, this swab that goes into the back of your nasopharynx, and we get a sample and we send it off to a lab.
And I forgot to mention this at the beginning of the call, but if any of you guys who are listening have questions, please just type them in the Zoom chat, and I'll be reviewing them, and we can ask Dr. Kramer any questions that you guys might have. Just talking a little bit about daily life, Zach, we had a question from one of our members emailed in, Amanda And she asked whether you thought it was okay if she has a friend who's been in isolation for 2 weeks at her apartment to come over to her place for, you know, a get together to hang out. If the only places she's going in between is from her apartment to her car to Amanda's place, whether that was a major concern in your opinion.
It's a great question. And people are asking us all the time because we are going stir crazy in our homes. I get it. Realistically though, the only way to beat this virus is social isolation. If I had a magic wand and I could just wave that wand and make every human being in the entire world stop in their tracks at least 6 to 8 feet apart, and we didn't have to go to the bathroom or eat or do any of that stuff, this virus would be completely eradicated in 3 weeks. Truth. That is the truth. Unfortunately, that's impossible. The only way this virus is spreading is through human-to-human contact. So, as I was saying earlier, I've been in isolation. So, did you go out for a walk today or yesterday? Did you go pick up your mail downstairs in your condo association or apartment? Did you go pick up your mail at the mailbox? Anytime you leave your house, you are at risk of contracting this virus unknowingly. So your social isolation goes back to day 0, the moment you leave your home. If you go to the grocery store, which I know we have been, back to 0. Let's say in a perfect world, you were in your home 14 days straight, never left, never did anything, had no contact with anyone, didn't order out any food, because don't forget that food coming into your house, those bags, cardboard, lives on cardboard for 24 hours. So you made all your own meals, you never left, didn't talk to anyone. The moment you leave your house, you touch your door handle of your car, you could possibly be infected. There's even concern that there's respiratory droplets of this virus can linger for hours in the air. The whole thing is we don't really know everything we can about this virus yet. You know, is it airborne? Obviously the large particles have lots of virus in it. So if someone sneezes in your face, that's bad. But there's concern that even just talking, even just breathing releases tiny small particles that are microscopic that can still inoculate and infect someone. So my answer is no. I do not think that that is safe. Even just going to touch her doorknob to open up the door to go into to that other person's house, you could inadvertently be getting it and then passing it on to that person, who can then pass it on to their family member, etc. The only way to combat this is social isolation. You want to keep your 6 to 8 feet distance from people if you have to go out. I mean, we have to get food, I get it. And then hand hygiene. Again, I don't touch something and then it soaks in through my skin and I get it. That's impossible. It's I touch something that the virus is on for whatever reason, and then I touch my mouth or I touch my nose or I rub my eye. I already washed my hands today, so don't, like right before this, so don't worry. Don't do that. That's how it's spread. So hand hygiene. I am washing my hands. If I touch anything, I have hand Purell on me at all times, or any kind of 60% or greater alcohol-based hand sanitizer. So it's a hard thing to hear, but the only way to combat this, to flatten the curve, to eradicate this disease, is let it burn itself out. And the only way to do that is complete social isolation. Isolation. I keep saying isolation.
Zach, thanks. Just talking a little bit about, yes, obviously, you know, we're going to be in our homes for a period of time. Most, actually all non-essential businesses, at least in Boston and most other areas of the country, are shut down for this period. You know, as far as what you can do in your house, you know, what do you recommend? Obviously, you know, we talk at Lynx a lot about fitness and nutrition and those things, but what can you do to keep yourself sane, both mentally and physically? And how important do you think, you know, the activities that you are doing in isolation inside your home are to keeping you healthy and helping you in the event you do get the disease to continue to combat it?
Absolutely. I mean, everyone's going through the same thing right now. We're all going through those stages of pretty much loss, of anger, anxiety, acceptance, grievance. You know, we're all going through the same thing. And it's important to stay positive. We are going to get through this. This is a hard time. This is a once in a century, once in a lifetime event that none of us will hopefully ever have to deal with again. But we got to stay positive. And the best ways to stay positive, you got to stay healthy and you got to stay active. Again, it's hard to stay active. You can't leave your house, but there are things you can do. I would definitely still recommend doing exercises. Lynx has set up a wonderful online program, which my wife and I have been doing every other day, which are fantastic. We're still doing our HIIT. We're still doing our Tabata. We're still following all the routines. And they've been fantastic, still getting my heart rate going. My muscles aren't atrophying too bad. So that's the most important thing. Stay active, stay fit, eat healthy. My wife and I have been making all of our own meals. We haven't gone out or ordered in once during this whole thing. And that sucks because you want to help local businesses and you should try to help local businesses. And it probably is okay to order out. And you just got to be wary of when you bring it into your home. And we can talk, if anyone has questions with that, I can explain things that you can do to help mitigate getting the disease from takeout. But definitely exercise. I would try to avoid alcohol as best we can because it is a depressant. You know, there are a lot of health other side effects that are not good with alcohol, but staying healthy, fit, talk to your friends, talk to your loved ones. But I definitely recommend at least 30 minutes of exercise daily, I think is probably the best thing you can do. To stay safe at home, wipe down your home regularly with Clorox bleach wipes or Clorox or any over-the-counter disinfectant spray, 409, Mr. Clean, you know, all those things. Try to wipe down daily. Wipe down the things that you touch regularly, light switches, doorknobs, the toilet handles, sink handles, things like that. Mask and gloves. Good question in my head. If you do need to go outside, if you do need to go for a walk, which you should, I do recommend that you try to get out and go for a walk, obviously keeping social distances. I 100% recommend that you wear a mask. And let me be specific here. Not an N95 mask, a surgical mask, or a homemade mask, bandana. There is lots of research that even just a surgical mask or bandana, it can help decrease spread of the virus up to 4 to 8 times than not wearing a mask. You know what's better than nothing? 4 to 8 times, so better. So it's not, the N95 mask is for me, for healthcare providers. When I go, I'm healthy right now, but if I go into a room with someone who has this virus, I can't get this virus because then I'm not there to help you. N95 masks should only be really reserved for healthcare professionals. If you have some, please donate them to your nearest hospital. We really, really appreciate it. The surgical masks are great though. They will help you, they will help prevent you from spreading the disease to others because that's covering any particles that might come out of your mouth, it's capturing them. So it's helping to spread the disease. And again, 25% of people that have this disease don't know it because they have no symptoms. They're just spreading it to everyone. Additionally, the mask will actually help prevent microns that other people are shedding at you from getting into your oral and nasal pharynx. So in other words, it will help protect you as well. So I definitely think you should. I think our government's a little behind on this. I guarantee you they will probably be soon recommending this, and I have been recommending it for quite some time. Gloves. Gloves are, in my opinion, worthless for the average person. I see people wearing gloves at the grocery store. I see people wearing gloves out on walks. Again, it cannot go through your skin. I see people wearing gloves, going to the grocery store, getting their groceries, which again is scary because there is a concern that you could get it from something in the grocery store. But then what do I see people doing? Touching their face with their gloves. It's the exact same thing. It's pointless then. It becomes moot, worthless. If gloves help you remember not to touch your face, then sure, that would be a good use of them. Gloves are for me when I go into a room and I do an exam on a patient, I put gloves on so that I then take those gloves off to help decrease the rate of infection when I go see the next patient next door. That's why gloves are important for healthcare providers. For the average person though, it's all about touching your face, wearing the mask, social distancing, and hand hygiene. So I carry Purell with me everywhere I go. If I'm at the store, I will wipe down my cart completely. I will get all my stuff, making sure to wear my mask and making sure as heck not to touch my face. I will buy all my stuff. The moment I get into, I load it into the grocery store, I'm Purelling my hands. Let it dry, get in my car, which I have already previously wiped down and I know is clean. Go home, unload the groceries, wipe off the surface that I unloaded it, put everything out, redo my hands again. And when I'm unloading, I make sure again not to touch my face or mouth. So gloves and masks, those are my two big things I did want to get across. And please, if you have N95, they are way overboard for what's going on right now for just walking around or going to the grocery store. A regular mask, totally perfect. Bandana works also decently well. I mean, the CDC told me to wear a bandana when we were running low on masks. So please, if you can, donate.
Just a question here related to obviously going to the grocery store, picking up Amazon packages. Any recommendations on putting them aside for a period of time or immediately wiping them down when? Yeah,
this is hard. So there are recommendations on this. The recommendations for getting a package is that if you have a house, you leave it in the garage for 24 hours. Then you bring it in. And I would honestly designate an area or space where which you can consider dirty, so that you can open things there, have things there, and then wipe it down when you're done. But the recommendation is to leave it somewhere for 24 hours, and then you can open it. For groceries, it's a little harder, again, as I said, because technically all those bags, all those groceries are contaminated. Some people do recommend literally wiping down, like going home, unpacking your groceries, and as you take it out, wiping it down with a wipe and putting it over into your clean side. You have a dirty and a clean side. And then once you're done doing all of that, you then wipe down the dirty side with disinfectant and throw out all of the cardboard and everything. So, I mean, that is the safest way to do it, but that's pretty difficult, to be totally honest, even for me. So I'm just being very cognizant about it. The thing about this virus is it does eventually die. If you wear a face mask, it's okay to reuse those, because if you put it aside, that virus will die in about 3 days. That's what they found. It's different for different substances, but for face masks, 3 days. So you can go back to that face mask in 3 days. For cardboard, it's up to 24 hours, things like that. So that's why some of them, it's days, but that's like metal and certain metals. So if you give it time, the virus will die. So that's why it is important to put things aside and let the virus die.
Great. We have a couple questions related to, you talked about masks, homemade masks, as well as surgical. Mm-hmm. One member wants to know whether it's too extreme to wear ski goggles out.
Is it, honestly, you're never going to be too overprepared. I wear goggles. All health professionals have to wear goggles or a face shield right now, because is it possible to get it through your eye? It is. It is a mucous membrane. But that would require someone to literally cough or spit in your eye, honestly, because it's more likely to get in through your nose or mouth. Is it too extreme? I don't think anything right now is too extreme. Is it necessary? Probably not. But if it makes you feel more comfortable, I think that's fine. That's one less thing you have to worry about touching your face accidentally. So, I mean, if that helps you, yeah.
Yeah, it sounds like the key is don't touch your face, and anything that helps you not touch your face.
Absolutely.
Yeah, cool.
Hand hygiene, all that good stuff.
Ski buffs, which I don't know. This is from Terry. I don't know what ski buffs are, but if you do, is that helpful? As
ski buffs?
I'm assuming it's a cover for.
Sorry, Zach. How you doing, man?
Hey, buddy.
Thank you very much for all this. It's great.
No problem.
Ski buff, just like, almost like, a cloth that you would put up when you're skiing.
Oh, I'm looking at Andrew. Yep. Yeah, that's fine too. I would double wrap it just to give you more, more cloth material. Those are fine. Yeah. I think those are great.
Yeah, because they cover both the nose and the mouth. So
and that's what you want to do. This is not a mouth thing. You need to cover nose and mouth. That's the important, nose and mouth. I've seen people with mask on out that's like this and their nose is sticking out. Not doing very much.
Cool, thank you.
Uh-huh.
And so this all, all these precautions that we're taking seem, everyone talks about flattening the curve. The whole point here being, if a lot of people are going to get infected with the virus, the idea being that we spread out the number of infections over a long period of time so that anyone that does get it and does, need really intense medical care is able to get it because the hospitals aren't overwhelmed.
Yep. Keep in mind,
yeah,
people are still getting sick. There's still heart attacks. There's still strokes, still broken bones, hopefully less because people are not out doing stupid things. But you get my point. The sick are still getting sick. They're still gonna be sick. Now we have this huge influx of these virus patients, and they are requiring huge resources. So anything you can do to help spread that out more is just better for the system, so we're not too overloaded. And unfortunately, we are being overloaded. I mean, New York right now is the epicenter, and we are going to be pretty close next. Right now, we have the 4th highest in the nation, behind New York, California, Oregon, and us. So the good news is our government here we've been doing a really great job here in Massachusetts. We took steps much earlier than other states. Social distance. I mean, I live in downtown Boston by Lynx actually, and it's a ghost town, which is great. That's what you want to see. As I said, if I could make everyone stop for 2 weeks solid, this would be over. But that's an unrealistic wish. So the best thing we can do is just help stop the spread. Social isolation, keep your social distancing, hand hygiene, and just be safe and do smart things. Some people are going to get sick. Some people will have no symptoms. Some people will have flu-like symptoms, which if you've ever had the flu is terrible. You feel like you're gonna die. You feel like you got hit by a bus. So those are gonna happen. But the only reason to go to an emergency department, to leave your house, is if you're having difficulty breathing, okay? That's gonna be the main, issue here. Obviously, if you're having don't let this, I hate to say this, but I've also heard of other people not going to the ER or emergency department for real life threatening issues because they're scared of COVID. Don't let that happen either. If you're having chest pain with exertion, go to the hospital. So don't let this interfere with your normal, idea of healthcare. We want to be safe, but if you're concerned about a life-threatening emergency, still get it checked out.
Thank you. Just one more question. You don't have to get too much into the science of it, but for a layperson, if you could talk about what they're doing out there to try to come up with a vaccine, and general timelines for an actual vaccine based on what you've heard.
Yep.
It'd be helpful for people to understand.
Yeah, generally, a vaccine takes anywhere between 12 and 18 months to make. And that is just the fact, even with today's technology. Because don't forget, you got to come up with it, but then we got to test it to make sure it works, and then make sure there's no side effects that kills, to make sure that it's not worse than the actual disease. And that's a huge process, even with speeding it along through the FDA. Realistically, timeline's going to be a year from the outbreak. So, I mean, since a year from January, and that's a best case scenario. I might be surprised, and they might push something through and get it done in 8-10 months, but realistically, I see at a minimum year. Most things are a year and a half. There are medications coming out that they think might help treat this. You've heard about plasma exchange, taking the plasma from someone who's beaten the virus and giving it to people that have the virus right now and aren't doing well. That's still under investigation. We don't have any data on that yet. It just started. They're using medications like azithromycin and chloroquinolone, which is a malaria drug, to help fight this. But again, we still don't know if that's 100% effective. These medications have serious side effects. So don't just go asking people to try to get these medications and pop in these medications, because the side effects of the medications will actually kill you. So you need to, these medications also are being reserved for the sick of the sick, the people that are really in the ICU, intubated, and need help. So We are working, the medical community is working every day to come up with treatment and a vaccine. So I think they're doing the best they can with the resources we have in the time span we have.
Any like supplements or vitamins, in the event you do get sick, or in preparation for that, any nutritional advice, is there anything that makes a difference?
Just for general health, I always recommend a multivitamin. There's data that it doesn't really do much, but they're a cent a day. So multivitamins are always good. Vitamin C is always good. None of these have been found to really be preventative. Some people say zinc is helpful for viruses. Again, not proven. These are all kind of hearsay. So honestly, not really, except for what I do know is staying healthy, staying active, staying athletic, boost your immune system. Eating healthy, boost your immune system. Stay healthy, stay clean, keep up with your normal daily workout routines if you can. Join the Lynx app and do the exercises. Join the daily Instagram workouts with the trainers, because they're fantastic and they're doing this, from their home, trying to help us out, knowing that we're all kind of stuck in the same boat.
Good question here for all the dog lovers out there. You mentioned that leaving your house, essentially your quarantine count goes to 0. If you have a dog, like, what are some best practices that you can think of offhand to help, maintain healthy to the best of your ability?
Yep.
Obviously
You gotta walk that dog. You gotta walk that dog. And it is a good chance for you to get out too. And as I said, people should be trying to go out. Don't let this, totally scare you. Just like I said, wear a mask is totally my suggestion. And a bandana, doesn't have to be a surgical mask, bandana, anything that can go over your mouth and nose, and hand hygiene. That's really it. Go for a nice stroll, try to social distancing. Don't try to go near people. It's hard to walk in the garden in the park when there's people everywhere, or down by the Charles. Go to offbeat, routes. It's really just stay away from people and don't touch anything, and then don't touch your face.
Great. And just for everyone out there, not to plug Lynx, but we do offer, especially for members, we do offer a lot of services here that help you when you're in your house, when you don't have any equipment, in order to stay active, keep your body and your mind fresh, both in the house, as well as if you need to go for a run or go out for a walk, and want to do some exercising in and outside of the house. So if you're interested, please email membership@Lynx Fitness Club, and we can offer a whole host of different services, whether they're free virtual classes or virtual personal training sessions with our awesome trainers. Zach mentioned that he's been doing the classes every other day, and Zach, I'm sure you're dealing with a lot of stress in your every job. So just to keep active and maintain a really healthy immune system, we definitely recommend staying active. So any other questions? I'm just
There's one about takeout meals.
Yeah.
Takeout meals, it's a good question, how to be safe with the takeout meals. Again, you should try to, support your local restaurants, but you just have to be safe with it. So try to avoid face-to-face contact. So if they can, drop it and leave, that's the best thing. Once you pick that up, consider your hands now contaminated. I would bring it into your home, unwrap everything without touching anything, throw out the paper, or better yet, recycle the cardboard paper that it came in. Wash your hands. Put it into a new container or a plate, i.e., and then microwave it for about 30 to 45 seconds. That will kill anything. So you've taken it out of the container it's in that could be contaminated, and now you have also heated the food to a degree that will kill the virus. So those are my tips for takeout meals, to making takeout meals more safe. It's really about, again, once you touch the bag that they've given you, you just have to be careful. Even if you could take the meals out and leave the bag outside of your house and take those meals in, the containers are still considered you still don't really know about those containers. Put the food into a different onto a plate, heat up that, throw out the containers, wash your hands.
And Zach, thank you again for your time. This is really super helpful. We appreciate it. And I know there's a lot of folks out there that are wondering how we can help to support you all as frontline healthcare workers. You know, like I said, risking your lives really every day. Any advice that you can provide, what we can do for you guys?
Absolutely. Let me just say this. Everyone in the community here has been absolutely amazing. My family and my friends who are actually also probably listening to this have been amazing and supportive. All that I can say is this is scary. You think it's scary for you. I'm going in every day. All the healthcare workers, it's not even just me, it's the other doctors, the nurses, the cleaning crew, their administrators, everything that makes a hospital run. All those people are still going in. And it's scary because we're literally in an area where people who have this disease are physically coming to see me. So the best thing you can do is just if you know a medical provider, just send them a text, say thank you. How are you doing? Because I can tell you the stress on myself has been immense. I go through days of sheer panic, sheer anxiety, and then I do a nice workout and I feel better. Just try to stay. Oh, sorry, my wife came in and made me lose concentration. You can send meals to your hospitals, to the EDs, to the nursing staff. That is very well received because we always love free food to shove in our face real quickly in a healthy manner while washing our hands in between seeing patients. So you can send food. If you have N95 masks or gloves, please donate. But honestly, just if you know a friend or a family, maybe you haven't talked to them in a while, just send them a text and say, I appreciate what you're doing. I hope you're doing okay. Stay safe, stay healthy. And I tell you, all that means the world to us because we're just as isolated right now as you are with the sheer fear of contracting this virus. And not only that, but bringing it home to our loved ones.
Awesome. Well, Zach, I just want to say thank you for your time. Doesn't look like we have any more questions.
I did have one quick question that said, can you let people pet your dog? Good question. I would avoid it. I really would. Because if they have it on their hand, now your dog has it on you and now your dog brought it back home with you. So as hard as that is, I honestly would avoid letting people pet your dogs. Unless they you watch them sanitize their hands, then you're okay. All
right. Thanks, Zach. Yeah, this was really helpful. Obviously, hopefully practical for everybody out there. And, it's been a difficult time for everyone. Thank you all for supporting Lynx, throughout this time. We'll try to continue to bring you really helpful content, both in the form of these types of informational seminars, as well as all of the group fitness classes that we're running on a daily basis, multiple times a day, and as well as all of the, expert fitness services that we can provide folks. So if you're interested, like I said, in any of those, please contact us at membership@lynxfitnessclub.com. We will also send you out an email after this seminar with some more information as well. But again, thanks everybody for tuning in. Text all your frontline healthcare provider friends and family members and let them know that we thank them for everything that they're doing.
All right, Bill, I really appreciate it. Everyone stay healthy, stay safe, stay athletic, stay active, and just try to stay happy.
Thanks.
Thank you, Zach. Thanks, man.